So to summarize this chapter on dilated cardiomyopathy, what are the key issues? Dilated cardiomyopathy is a common cause of heart failure. It is a primary myocardial disease which affects the left ventricle but also the right ventricle, which causes dilatation of the left ventricle with a reduction in left ventricular function. Often we find elevated filling pressures with a dilatation of the left atrium, and ultimately we will find pulmonary hypertension. There are large regional variations as to the cause of dilated cardiomyopathy. Causes include genetic factors, inflammation, specifically viral infection, immunologic factors, which can be associated with viral infection but also with other factors, toxic agents such as drugs and alcohol, and in a large number of patients you will not find a cause unless you perform an extensive workup which includes biopsy. Echo is the primary tool to make the diagnosis of dilated cardiomyopathy. It allows us to assess the severity of the disease, find possible causes, estimate the prognosis, find complications such as thromboembolism, and give us clues as to how to treat the patient. Assessment should include left and right ventricular function. Remember, specifically right ventricular function correlates well with symptoms and also with prognosis. Diastolic function to look at left ventricular filling pressures. Those correlate well also with symptoms and prognosis. Mitral regurgitation, remember MR is detrimental to the left ventricle, and the presence of MR reduces the prognosis and the survival of the patients. Finally, look at dysynchrony because it could open the field to a new form of treatment for these patients. Be aware of specific forms of cardiomyopathy, for example, ischemic cardiomyopathy, which looks very similar to dilated cardiomyopathy in the end stages of the disease, but which is not a primary myocardial disease. Non-compaction, which is important because it can be subtle and it needs further follow-up and family screening. Peripartal cardiomyopathy, which occurs during pregnancy. Chagas disease, which is very common and frequent in South America, and which causes aneurysms and regional and global dysfunction. And tachycardia, as well as arrhythmia-mediated cardiomyopathies, which are reversible.